For a long time, one of the things that we have discussed about the proposal of Medicare for all for people here in the United States is that if it doesn't have price controls for big pharma, then it may not necessarily do anything to solve our healthcare crisis here in the United States. But luckily, we aren't the only ones who had that thought. Members of Congress understand that as well, because it's not enough to give people health insurance coverage. Yes, that is a huge part of the fight, but beyond that, even people with insurance coverage today are going into debt because of their medical bills, and many of them still can't even afford their prescription medications. But again, Congress is listening. And luckily, we don't have a Congress anymore that's dumb as a box of rocks. We actually have some really intelligent people there crafting really intelligent legislation. Specifically, I am talking about Democratic Representative Pramila Jayapal. And my apologies if I've mispronounced that name. But either way, Ms. Jayapal has come up with this Medicare for All legislation that not only would give Medicare for all, but it would require drug companies to negotiate prices with the Medicare program that at that point would cover every single American citizen. And it's not just, okay, we'll negotiate prices, we'll get them down a little bit lower. What this legislation does, which is the most brilliant thing ever, is that it says if you're not going to negotiate with us, if you're not going to get your price down to where we want it, guess what we're going to do? We're going to issue a waiver patent to a generic company to make your drug at the price that we want. Then you have nothing you can do about it. We're the government. We can change patents if it's an emergency, which this is. So you'll either be forced, Pfizer, Merck, whoever you are, to lower your costs to what we want it to be, or your drugs aren't going to be covered under the program anymore and nobody's going to buy them. Then you lose all your money. That's what's needed. That's what's been missing so far from at least the public conversations about this. Because again, Medicare for all is only about half the battle. The other half is getting these prices down so that people with coverage can still afford them. And that's what this piece of legislation does. And yes, it has a phenomenal chance of passing the House of Representatives. It has a 0% chance of passing the Senate because of the Republicans who don't care if we have health care coverage. But this is the model, folks. This piece of legislation that has been proposed, you find a link in the description of this video, go check it out. This is what has to happen. For me, this is the new bar. We raised the bar a little bit here. Representative Jayapal did. And if any subsequent Medicare for all legislation does not include this kind of price negotiation caveat, then it's not good enough. This is the new bar. It has been set, and it is one hell of a bar to cross. But we can do it. We just have to wait till we get the majority in the Senate. But once we do, the ball is already rolling. We see this happening. This is an inevitability here in the United States. It is going to eventually happen. And hopefully, it's going to happen under this proposed model, because that is the only way that even with insurance coverage, we would actually be able to pay for our health care that we receive. Thanks for watching, everybody. And don't forget, if you like what you see here, like, comment, share, and subscribe to our channel. And now you can also become a member of Ring of Fire and get exclusive early access to certain Ring of Fire videos all throughout the week. Just click on the little join button right below the video.